Okay, then we have also here the urine crystals, normal urine crystal found in your alkaline urine. The first one, we have your amorphous phosphate. Amorphous phosphate, just equivalent to your amorphous urate in your acidic urine. It also appears to be granular, and it's being precipitated here once you have your refrigerated your urine sample. And again, however, here, unlike your amorphous urate, amorphous phosphate could not be dissolved by warming your urine sample. It's being dissolved by addition of your acetic acid. Then we have your triple phosphate or your ammonium magnesium phosphate would have your characteristic na coffin lid appearance, para siyang kabaong. Okay, so once this try to disintegrate, that would eventually produces here a feathery appearance. And usually it could be found here in the urine sample with the bacterial infection containing here the urea splitting na mga bacteria. Then we have your calcium phosphate. Calcium phosphate appears to be colorless, rectangular, flat na plates, and would resemble here thin prism in rosette formation. Calcium phosphate may also resemble here our sulfonamide crystals. Only that, ang pinagkaiba, calcium phosphate, upon addition of your acetic acid will be dissolved, whereas your sulfonamide will not be dissolved by your acetic acid. Next, we have your calcium carbonate, colorless. It's spherical in shape. It's dumbbell in shape. Upon addition of your acetic acid, it will be dissolved with the gas formation. So may bubble formation siya, mawala siya with the bubble formation, so that would identify your calcium carbonate. And then we have also here your ammonium biurate. So it's a spicules sphere siya, so meaning to say bilog with a spicules. Would have here the characteristic na thorny apple appearance. Okay, usually your ammonium biurate dissolve at 60 degrees Celsius with your acetic acid that would eventually convert that one to the uric acid. Okay, usually your ammonium biurate is present here in the old specimen or even the presence of your high level of your or high concentration of your urea splitting bacteria. Okay, now we go to your abnormal urine crystals. Usually, abnormal urine crystals are found here in the acidic urine. The first one, we have the cystine. Cystine here is your hexagonal plate, six-sided. So, para siya kaninang uric acid natin. Your uric acid could assume also six-sided. Again, pinagkaiba nilang dalawa, your uric acid is capable of polarization with our polarized light microscopy. Is birefringent, whereas sa ating cystine, usually hindi siya birefringent except yung thick na cystine crystals. Ang cystine crystal here is able to be formed here in the patients with the Cystinoria. So Cystinoria is an inborn metabolic disorder characterized by inability of our renal tubules to reabsorb your cystine. So pagdaan niya dun sa ating proximal convoluted tubule, usually dapat nire-reabsorb siya ng ating proximal convoluted tubules, and the cystine will be returned back to our blood circulation because cystine is one of your amino acid. But apparently, ang cystinoria hindi niya na-reabsorb and therefore, lumalabas na sa ihi natin, it try to precipitate in the form of your cystine crystals. Confirmatory test for the presence of your cystine. Okay, we have your cyanide nitroprusside test. It will give a positive result for the cystine. Okay, the next one, we have here your cholesterol crystals. So this would be present here upon refrigeration of your specimen in high lipid concentration of your urine sample in the case of your mga lipidoria, nephrotic syndrome. So cholesterol crystals characterized here as rhombic, square, rectangular with notch corner. So medyo ganyan din. Okay, or would have your characteristic na broken staircase hagdan, parang ganon, na appearance. Okay, so another crystal here, we have your radiographic contrast media dye crystals here. So this one would resemble our cholesterol crystal. So it appears to be rectangular din siya. Differentiation here is by checking for medical history of the patient. So usually pag radiographic dye crystals here, so mean to say the patient has undergone radiographic procedure, mga x-ray na procedure na binigyan siya ng radiographic mga contrast media. At the same time, they could also be identified here as having a high specific gravity. So that would differentiate that one with your cholesterol crystals. And then we have also here the crystal associated with our liver disorder. So it should be positive here for the chemical test for your bilirubin. That will signify that the patient would have a liver problem and is highly infectious. Okay, so first one, tyrosine crystals appears to be like needle-like crystals which are yellow in color. Leucine is sphere with the concentric striations. So parang bilog lang siya na may mga, okay, so parang ganun. Okay, then we have also here your bilirubin usually appears to be clumps of the needle and granules. So ito ay medyo matusok, pointed. Ito is less pointed compared with dito. And usually they form clumps that would differentiate your bilirubin crystal from your tyrosine crystals. So sulfonamic crystal here is a type of the crystals that usually tend to precipitate if the patient has undergone medications to try to take in sulfate drugs without adequate hydration. I mean to say, hindi siya masyado uminom ng water and therefore it tend to precipitate. Your sulfate drugs appears to have your variety of forms and shapes. Appears here like needles, rhombic, whetstones, rosette. And usually it ranges here colorless to yellowish brown. Usually mga yellowish brown color ito. Another one we have here related to your medication, we have your ampicillin crystal. Ampicillin crystal tend to precipitate for someone who has taken in ampicillin without adequate hydration and usually tend to precipitate here once the specimen has been refrigerated. And your ampicillin crystals appears also like a needle-like na crystals. Okay, then we have also here the artifacts that might be mistaken here for some of our crystals and other important na mga cellular sediments in our urine. So first one, we have your starch granules. Starch granules, usually from the contamination of our urine sample with the gloves. Okay, starch granules would appear like a spherical with a dimple center and also capable of the Maltese cross just like our cholesterol. Oil droplets, air bubbles are, pag oil droplets, that's contamination of your oil. And usually perfect circle ito. Air bubbles here, it might be perfect circle or pwede siyang hindi. And then again, they are highly refractile and that should be differentiated from our red blood cells. So para ma-differentiate, you can add your acetic acid for that. Pollen grains, considered here to be a seasonal contaminants. Ito yung lumabas sa board exam namin dati. Ito yung kanyang question. Seasonal contaminant that would appear here in our urine sample would have cell wall, so coming from your plant kasi siya, that's why it would have the cell wall and would also have here the concentric na circles. Fibers appears like, to resemble here our cast, and most likely yung fibers natin much longer compared to your cast, and your fibers also refractile. Usually in cast natin, they are not refractile except your fatty cast. Ang fatty cast lang ang cast na refractile. Okay, usually fibers coming here from the diaper of the patient or even from the clothing of the patient. And that might be mistaken here as our cast. Okay, so for this topic, just need to identify the significance, their shapes, their morphology, and of course here you need also to be familiarized with the actual morphology that one under the microscope. Okay, so that's all for our microscopic examination. Okay, thank you.